In a major push to the vaccination, Drugs Controller General of India DCGI allows foreign-made COVID-19 vaccines to be launched without the requirement of post-approval clinical trials. Requirement for the assessment of the first 100 beneficiaries remain. Union Cabinet approves the Model Tenancy Act. Union Urban Development Minister says the new act will instill confidence in house owners, will open up lucrative tenancy market worth 1.5 lakh crore. After central government's decision to cancel CBSE 12th board exams, several states follow suit. Announced cancellation of 12th board exams in states. Caribbean Supreme Court to consider implementation of international red corner notice to fugitive fraudster Mehul Choksi today. Choksi is accused of defrauding Punjab National Bank of 13,500 crore rupees. And in cricket, Team India led by Virat Kohli to leave for England tour tonight will play the first ever World Test Championship final against New Zealand at Southampton on 18th of June. Will later play a 5-test series against England. Good evening, welcome to English News. I'm Anil Thomas. Now for the stories in detail. The Drug Controller General of India, DCGI, today waived the requirement for conducting bridging clinical trials and testing of every batch of vaccine by the Central Drugs Laboratory, Kasoli, for foreign-made vaccines to ease the supply of imported COVID vaccines. Norms for vaccine already approved for restricted use by the US Food and Drug Administration, the European Medicines Agency, Medicines and Healthcare Products Regulatory Agency UK, Pharmaceuticals and Medical Devices Agency Japan, or which are included in the WHO emergency use listing, have been eased. The DCGI said scrutiny of the summary lot protocol and the certificate of analysis of batch or lot shall be undertaken by the CDL for release as per standard procedures and requirements of assessment on the first 100 beneficiaries for 7 days for safety outcomes before the vaccine is rolled out. The Union Cabinet, chaired by the Prime Minister Narendra Modi, has approved the Model Tenancy Act for circulation to all states and union territories for adaptation by way of enacting fresh legislation or amending existing rental laws suitably. It will help overhaul the legal framework with respect to rental housing across the country, which would help spur its overall growth. The Model Tenancy Act aims at creating a vibrant, sustainable and inclusive rental housing market in the country. It will enable creation of adequate rental housing stock for all the income groups, thereby addressing the issue of homelessness. Model Tenancy Act will enable institutionalization of rental housing by gradually shifting it towards the formal market. The Model Tenancy Act will help unlocking of various vacant houses for rental housing purposes. It is expected to give a fillip to private participation in the rental housing as a business model for addressing the huge housing shortage.
Model Tenancy Act है, this provides a model both for urban as well as rural. The Model Tenancy Act will provide an overall regulatory framework. How we will bring more empty and vacant units into the productive economic sphere. Template or Model Tenancy Act will apply to future transactions. And the effort will be to take people from informal arrangements to a specific contract arrangement between the buyer of a service and the seller of a service, which in this case is the tenant and the landlord. It would be a written agreement with the terms and conditions to be determined by the landlord and the tenant. इस मॉडल टेनेंसी एक्ट की इंप्लीमेंटेशन से लैंडलॉर्ड्स में कॉन्फिडेंस आ जाएगा.
Well, after the central government's decision to cancel the CBSE 12th board exams in the wake of the ongoing COVID-19 pandemic, several states followed suit and have announced their decision to cancel the exams.
छात्रों के हित में लिया गया ये प्रधानमंत्री की चिंता है और ये जो निर्णय है उन्होंने काफ़ी सोच विचार करके और पूरे देश के परिप्रेक्ष्य में लिया है, क्योंकि अभी भी तमाम प्रदेशों की स्थितियां सुधरने की ओर तो हैं, लेकिन अभी कई प्रदेश ऐसे भी हैं जहां कोरोना का जो संक्रमण है कम नहीं हुआ है. मैं समझता हूं कि ये इस निर्णय का सभी तरफ स्वागत हुआ है.
सरकार ने प्रधानमंत्री जी के नेतृत्व में, विशेष करके प्रधानमंत्री जी आज की माहौल को देखते हुए देश की भविष्य की स्वास्थ्य को सुरक्षित करने के लिए कोई जोखिम ना उठाते हुए 12वीं की परीक्षा को रद्द किया है. इंटरनल असेसमेंट की आधार पे 11वीं और 12वीं दो जो पिछले दिनों में इंटरनल एग्जामिनेशन हुए हैं उसकी असेसमेंट के आधार पे उनकी नतीजा आएगी. हायर एजुकेशन में उनको दाखिला देने के लिए पिछले साल जैसे सुविधा भी रहेगी. बच्चों की भविष्य को कोई खतरा में ना डालते हुए ये निर्णय किया गया है. ये बहुत ही अच्छा निर्णय है. ये देश की नई पीढ़ी के लिए और सुरक्षा देने के लिए एक बड़ा कदम है.
Well, India continues to register a decline in the new daily COVID-19 cases. 132,788 daily new cases were registered in the last 24 hours. The country has recorded less than 2 lakh daily new cases for 6 continuous days now. India has been witnessing a continuous fall in the active caseload. 17,93,645 active cases have been reported to date. A net decline of 1,01,875 cases have been witnessed in the last 24 hours. Active cases are now only 6.34% of the country's total positive cases. Recoveries, meanwhile, continue to outnumber the daily new cases for 20 consecutive or successive days. Well, 2,31,456 patients have recovered in the last 24 hours. A total of 2,61,79,085 total recoveries across the country so far. The recovery rate continues to increase at 92.48%. Weekly positivity rate currently stands at 8.21%, while the daily positivity rate dipped to 6.57%, less than 10% for the 9th consecutive day. Well, India continues to vaccinate its population against COVID-19. The cumulative number of COVID-19 vaccine doses administered in the country stands at 21,85,46,667. As on day 137 of the vaccination drive, that's the 1st of June, a total of 23,97,191 vaccine doses were given. Centre has taken steps to accelerate the domestic vaccine production and more than 23 crore vaccine doses provided to states and union territories. More than 1 crore 64 lakh doses still available with states and union territories to be administered, while 61.06 million doses of vaccines administered by the states and union territories in the month of May 2021. 16.22 million balance unutilized doses are available with the states and union territories as on 31st of May 2021. So the total vaccines that have been provided, more than 23 crores being provided to the states and union territories. Well, a 500-bed COVID care hospital set up by the Defence Research and Development Organization, that's DRDO, in Haldwani, was virtually inaugurated by the Chief Minister of Uttarakhand, Tirath Singh Rawat, today. This facility comprises 375 oxygen beds and 125 ICU beds with ventilators. With 100% power backup, it is centrally air-conditioned for all weather conditions. Pathology laboratory, pharmacy, X-ray and ECG are inherent part of the facility. The center will become fully operational from the 3rd of June. This hospital, which has been built in 21 days, is the result of the efforts of the workforce of 350 people who worked relentlessly around the clock under adverse weather conditions. Well, the Labour and Employment Ministry has announced additional benefits for workers through social security schemes run by the EPFO and the ESIC amid the COVID-19 pandemic. Speaking exclusively to DD News, Union Labour and Employment Secretary Apurva Chandra said that these benefits include pensions for dependents of insured persons who died due to COVID-19 and a hike in the minimum sum assured under the group scheme or the group insurance scheme run by the EPFO to 7 lakh rupees from 6 lakhs.
%90 of the last pay drawn would be paid to the dependent, that is the dependent wife or mother or the children, the son or unmarried daughters. For the wife and mother, till they are alive, this pension would be given. For the son, till he attains the age of 25, and or for a daughter till she gets married. From the employee deposit linked insurance, the amount of compensation has been raised. Now it has been made a minimum of 2.5 lakhs and a maximum of 7 lakhs. So depending on the last pay drawn, the benefit would be given as a lump sum to that family, to the dependents. There would also be a pension from the Employee Provident Fund organization in case of an unfortunate death, which may range between 1,000 rupees to 3,000 rupees minimum. So that also will be available to the dependents. Gratuity would also be available.
Well, some states have started to ease curfew or lockdown-like restrictions amid a gradual decline in the number of cases. In Bihar, concessions have been given for business activity during lockdown from today. The lockdown in the state will continue till the 8th of June. All types of shops and business establishments will open on alternate days from 6 a.m. to 2 p.m. As per the revised guidelines, all government offices will function every day till 4 p.m. with 25% attendance. Private and non-government offices will remain closed and banks will function till 2 p.m. As the declining trend in COVID-19 cases continues, Rajasthan government has also started the unlock process of easing certain restrictions from today. According to the guidelines for the modified lockdown, exemptions for various activities will be given only in areas where the positivity rate is less than 10%. All government offices of the state will open from 9:30 a.m. to 4 p.m. with the presence of 25% employees till the 7th of June and an increase to 50% after that. While private offices can be opened up to 2 p.m. with the presence of 25% employees, the weekend curfew will remain in force every Friday afternoon from 12 noon to 5 a.m. Tuesdays till the number of active cases in the state reduces to 10,000. Public discipline curfew will continue on the rest of the days from 12 noon to 5 a.m. the next day. Well, apart from the government's assistance during the pandemic, some voluntary organizations are also coming forward to lead India to the gateway of recovery. They are reaching out to the affected families and providing them with the facilities that they need. To achieve this noble goal, the support of institutions like the CISF is playing a major part. Let's take a look at this special report.
The Yug Sanskriti Trust has been engaged in resolving the problems that are being faced by many amidst the COVID-19 pandemic. The Trust is providing relief to the needy people in collaboration with the Central Industrial Security Force, a paramilitary force. With this noble cause, food and medical kits were distributed among 300 persons of Anna slum living near the Pragati Maidan in New Delhi. Along with this, vital information was also provided to the slum dwellers under the awareness campaign to prevent the spread of coronavirus among the people.
ये कोशिश शुरू की है कि हम अपने CISF के बाहर भी आके गरीबों को, ज़रूरतमंदों के लिए हम कुछ करें। इसमें युग संस्कृति न्यास जो आचार्य जी हमारे बहुत पुराने मित्र हैं, उनका सहयोग हमें हर समय बना रहता है। उन्होंने इसमें ही बहुत सहयोग किया है, आगे भी सहयोग करते रहेंगे। हमने क्वारंटीन सेंटर खोला है, आइसोलेशन सेंटर खोला है, कंसंट्रेटर्स इन्होंने हमको दिया है, हम वेंटिलेटर्स लेने वाले हैं, हमने एम्बुलेंस इनसे कह के अपनी लोगों के लिए सुविधा उपलब्ध कराई है। इससे ये साबित होता है कि हम पुलिस वाले एंड एनजीओ जो युग संस्कृति न्यास है, हम लोग बहुत कुछ कर सकते हैं। हमने शुरुआत की है और हम ये करते रहेंगे। कोरोना काल में भी करते रहेंगे, कोरोना काल के बाद में भी करते रहेंगे।
मास्क से लेकर सैनिटाइजर से लेकर डॉक्टर के सलाह पे हर जरूरत की चीज़ हमने प्रयास किया है। इस तरह से जहाँ जरूरत है युग संस्कृति न्यास ने 4 हेल्पलाइन नंबर इशू कर रखा है। जिनको भी जरूरत हो उसे हेल्पलाइन नंबर में कभी भी संपर्क करें।
Yug Sanskriti Trust is a voluntary organization which is making efforts to strengthen the battle against the pandemic across the country. It is providing essential items to the families of the COVID victims. Such efforts are highly commendable in a time of crisis like this. Rajesh Raj report from Delhi, TD India.
Well, in order to expedite the COVID vaccine production in the country, the Government of India announced Atmanirbhar Bharat 3.0 Mission COVID Suraksha initiative. Under the mission, the central government allowed Maharashtra's government's Hafkin Biopharmaceutical Corporation Limited to start production of Covaxin, a COVID-19 vaccine developed by Bharat Biotech. Let's take a look at this report.
In order to increase the production of COVID vaccine in the country, the Government of India announced the Atmanirbhar Bharat 3.0 Mission COVID Suraksha initiative. Under the mission, the Department of Biotechnology, Government of India is providing financial support as well as upgrading required infrastructure and technology of many public sector vaccine manufacturers. Mumbai's Hafnik Biopharmaceutical Corporation Limited, the state-run enterprises, got approval from the central government to start the production of Bharat Biotech's Covaxin. Dr. Renu Sarup, the Secretary Department of Biotechnology and Chairperson of BIROC, said the enhancing vaccine production capacity using public sector asset will go a long way in building production capacity of vaccines in the country to support the massive vaccination drive. With the help of the Ministry of Science and Technology, Bharat Biotech will sign MOU and transfer the technology to Hafnik Biopharmaceutical Corporation Limited. Sandeep Rathod, Managing Director of Hafnik Biopharmaceutical Corporation, said that with the technology in place, the institute will be manufacturing the drug substance at their BSL-3 laboratory, which are being made. And as part of the next step, the vaccine will be filled in bottles and product will be finished.
इस प्रोजेक्ट में हमको इस 2 इम्पॉर्टेंट स्टेप्स है, जिसमें पहला हमारा जो बल्क प्रोडक्शन है उसकी फैसिलिटी तैयार करना, जिसके लिए BSL-3 फैसिलिटी लगती है, उसका कंस्ट्रक्शन निर्माण करना, और दूसरा है उसके साथ उसका फिल फिनिश। तो ये BSL-3 फैसिलिटी तैयार करना ही सबसे महत्वपूर्ण इम्पोर्टेंट स्टेप है, जिसके लिए हम युद्ध स्तर पर काम कर रहे हैं। और ये एक बार हो जाएगी तो हमें लगता है कि जो टाइमलाइंस इसके लिए निर्धारित की गई है, इसमें हम ये कंप्लीट कर सकेंगे।
Hafnik Biopharma has been provided with a 65 crore grant by the centre and rupees 94 crore from the government of Maharashtra. The corporation is preparing the facility to start the production, and in a few months' time, the company proposes to produce 22.8 crore doses of Covaxin in a year. Hafkin Institute is one of the oldest biomedical research institute in the country and was established in 1899. It has developed an anti-rabies serum, anti-venom serum, oral polio vaccine, among others. Shishi Shaila's report, TD News, Mumbai.
Well, a Dominican court is expected to hear fugitive businessman Mehul Choksi's extradition plea to India today. Mehul Choksi is awaiting a hearing while being in the jail in Dominican, a Caribbean nation neighboring Antigua and Barbuda. The Dominican court has also stayed the businessman's movement out of the country based on the lawyer's appeal and scheduled the hearing for Wednesday. Since India has no extradition arrangements with Dominica, it is believed that the government has sent a team of officials to the Caribbean country in an attempt to bring him back to the country. Choksi was reported missing a week ago from the island nation of Antigua and Barbuda, where he has been hiding for over 2 years, evading Indian law enforcement agencies. The latest events have given hope to the Indian law enforcement agencies to lay their hands on Mehul Choksi earlier than expected. Mehul has taken the citizenship of Antigua and Barbuda only a few months before the whole Punjab National Bank money embezzlement scam by Nirav Modi and his allies were unearthed. After India's extradition request to Antigua and Barbuda for Mehul Choksi as a money launderer and criminal offender, the local government has initiated the process to cancel Choksi's citizenship granted under the Caribbean Nations Citizenship by Investment Program, that's CIP, in November 2017, but he has challenged the government's move in court. As the news of Choksi's escape to a neighboring nation surface, Antigua and Barbuda Prime Minister Gaston Brown has given clear instructions to authorities in Dominica to have Mehul Choksi repatriated to India. Well, for more on this, we are joined by our correspondent Abhishek Jha. Abhishek, minutes away from this particular, matter to be deliberated in court. But what are the options, especially available for the Indian law enforcing agencies and the team that is there, especially as this court battle begins?
So, Anil, the Indian law enforcement agencies are going to present with documented evidences of his criminal offences in India. And also the money laundering, activities that he has been involved in. We know that in Punjab National Bank, almost 40,000 crore rupees of money has been siphoned off, and he was one of the key accomplices with Nirav Modi in that whole scam. So if Indian agencies are able to establish the fact that he is still an Indian citizen and he is not a citizen of Antigua and Barbuda because his Indian citizenship has not been revoked, or his surrendering of Indian passport has not been cleared as a certificate has not been issued of that effect. So he still remains the Indian citizen, and hence he should be repatriated to India after the Dominican, the Dominican nation ascertains the fact that whether he was forcibly brought to the Dominica or whether he is an illegal entrant. So in all these cases, Indian agencies want to establish that Mehul Choksi is still an Indian citizen, and hence he should be repatriated back to India.
Okay. Also looking at the fact that since there is no extradition treaty between India and Dominica, does the fact that there is a red corner notice that been issued by the Interpol, is that the ground on which, India is hoping that things could fall very much in their place, and that could be reason enough for the court to grant extradition rights to India?
This is a very strong argument that Indian agencies are still trying to pursue with the Dominican court. But in the case that, Mehul Choksi is the side, our defendants are trying to put forth that he was forcibly brought to Dominica and he is still a citizen of Antigua, and as he should not be treated as an illegal entrant. Rather, he should be given a fair trial as somebody who has been kidnapped and forcibly brought to Dominica. So after deciding on the merit of various arguments, if the court, decides to the factor that this person, that Mehul Choksi is still has some merit in his argument, he can still be sent back to the origin of the country from where he has actually come down to Dominica. And the origin of that country remains Antigua and Barbuda. It is not India, because he has been living in Antigua and Barbuda for almost 2-3 years now. So depending on the arguments and the merits of case and the sides, like Indian agencies are presenting their own side, Mehul Choksi's lawyers are presenting their side, and Antiguan government has also presented their side that Mehul Choksi's citizenship is still not finalized, and he is still not finally citizen of Antigua Barbuda, which is still under contestation in Antigua and Barbudan courts. So depending on all the arguments, we can hope that there will be some judgment in this case later, maybe a couple of hours from now. Okay,
we'll leave it there. You've got a busy evening ahead. Take good care of yourself. We'll come back to you for more updates on that developing story there in the courts. Well, moving now to Telangana state that's celebrating its 8th formation day today. Governor Dr. T. Sundarajan and the Chief Minister K. Chandrasekhar Rao have greeted the people of the state on the occasion. President Ramnath Kovind has extended best wishes to the people of Telangana on the occasion of the state's formation day. In a tweet message, the president said, and I quote, "Greetings to all, especially to the people of Telangana on Statehood Day. I wish Telangana continues to expand its traditional, modern and futuristic industries. It has fulfilled the national objective of providing water to every home, wishing a bright future for the people of the state." Vice President also greeted the people of the state on the occasion. In a tweet, he said, Telangana is home to age-old traditions and is known for its rich history, diverse culture, heritage and architectural grandeur. He added that the state and its able people have contributed immensely towards the development of the nation and extended his best wishes for the progress, prosperity of the state and the well-being of the people. Prime Minister has also extended greetings to the people of Telangana on the state's formation day. Prime Minister tweeted, "The state is blessed with a unique culture and hardworking people who have excelled in many areas." He also offered prayers for the good health and well-being of the people of Telangana. Union Minister for Information and Broadcasting Prakash Javadekar also greeted the people of Telangana. In a tweet, he said, "Warm greetings to the people of Telangana on the state formation day." He prayed for the prosperity and good health of the people of Telangana. Well, the domestic stock markets ended flat after a volatile trade on Wednesday. So the Sensex or the BSE lost 85 points to close at 51,850. The Nifty, the National Stock Exchange, gained just 1 point to close at 15,576. But in the broader market, the BSE mid-cap surged as much as 1.8%, while the small-cap index jumped 1.3%. The major gainers in the Nifty were UPL, Tata Steel, SBI, Life Insurance, Adani Ports and Reliance. Among the sectoral indices, the auto, metal, energy and PSU bank indices rose between 1 and 3%. Well, before going to the England tour, Indian cricket team coach Ravi Shastri said in a virtual press conference that the tour is important. The Test Championship is a very difficult format and he hopes that the team will do well in the English tour. Captain Virat Kohli said he did not want the team to play under pressure, but it is the time for him and the other players to enjoy. He is not personally feeling any kind of pressure. Well, that's all we have time for in this edition of news. Thanks for watching. But the battle against COVID-19 continues. Remember, 3 simple things to follow. SMS, that's maintaining social distance at all times, wearing a mask at all times, and also sanitizing yourself. You follow the 3 simple steps. Also, if you are in the age group to get yourself vaccinated, do not forget to register yourself and get yourself vaccinated, because the battle against COVID-19 continues. You and I need to see a better tomorrow. Thanks for watching.